Imagine FSH going down from 50 to 7. In this video, I'll be sharing with you a few easy things you need to stop doing because they are not helping you on your fertility journey or egg quality. If you're excited about this topic, give it a thumbs up and leave a comment below to let me know. And please subscribe because when you do, I know that this video is a topic that you want to learn more about. In today's video, we'll look at what causes high FSH in women. How does FSH affect fertility? And we'll also look at how to lower high FSH for optimal fertility. So get rid of all distractions and make sure you watch to the end. Don't skip any part. FSH is follicle stimulating hormone. It is a hormone that is released by the pituitary gland, which is located at the base of the brain. In women, FSH plays a very crucial role in the reproductive system. It stimulates the growth and development of follicles in the ovaries, which contain the eggs. In men, FSH stimulates the production of sperm in the testes and also supports their maturation. Your levels of FSH can vary throughout your menstrual cycle, and the levels are influenced by your estrogen and progesterone levels. So in reproductive medicine, your FSH levels has always been the main diagnostic tool that have been used for decades in assessing how your ovaries are functioning as a woman. What is the normal FSH value? So do your FSH test. It is done between day 2 to day 4 of your menstrual cycle. So considering the fact that FSH levels increases as a woman gets older, age-specific FSH levels were established to determine normal ovarian function. If you are 33 years and under, your FSH levels is considered normal if it is 7 international units per milliliter. Women aged between 33 and 41 should have FSH level between 7.9 and 8.5. After menopause, your FSH levels as a woman rises to between 25 to 134. But there are women in their late 20s and mid 30s with FSH levels in the menopausal range, and they are finding it very difficult to conceive even with IVF. I'll be sharing the solution to this shortly, but before we continue, if you have gotten some value so far, you need to subscribe. So hit the subscribe button and then let's continue. Thank you if you have just subscribed. So what does high FSH mean for your fertility? High follicle stimulating hormone are frequently seen in women diagnosed with premature ovarian failure. Once the FSH levels reaches 30 to 40, it becomes very difficult for women to conceive. Every woman needs to understand that FSH, high FSH, is not the disease. It's just a symptom, is an indicator of ovarian dysfunction. It shows that the ovaries are not functioning optimally again. You see, your ovaries are responsible for producing hormones and releasing eggs during a woman's reproductive years. FSH plays a very crucial role in stimulating the growth and development of follicles which contain the eggs. But when the ovaries are not functioning optimally, they may not respond well to FSH stimulation again. The end result is that this leads to reduced production and release of estrogen and other reproductive hormones. So when the body discovers that the ovaries are not responding, so as a compensatory mechanism, the pituitary gland releases more FSH to stimulate the ovaries further. Therefore, high levels of FSH in the blood are often observed with women with decreased ovarian function. So if you are not menopausal, you are not yet in the menopausal age, what are the reasons, what are the factors responsible for high FSH? It is very normal for your FSH to be high if you are menopausal. There's nothing wrong with that. But if you are still in your 20s, your early 30s, mid 30s, and your FSH is high, this is really abnormal. So what can be the root causes? In this video, I'll be discussing 3 major causes. There are other causes, but I'll be focusing on 3 causes that you need to take seriously and work on. Number one is toxins. Toxins from chemotherapy treatment or radiotherapy treatment are known to be very toxic to the ovaries. These therapies damage the genetic material in the cell. Other toxins are herbicides and pesticides. They damage egg quality and interfere with egg development within the ovaries. Included are cigarette smoke and certain viruses. The number 2 factor responsible for FSH as a result of ovarian dysfunction are autoimmune diseases. In this situation, your immune system produces antibodies against your ovarian tissues, harming the follicles and damaging the eggs. Autoimmune conditions damage your body's tissues and hormone secreting glands. So this situation is like a case of an army that is supposed to protect its citizens, but is now turning against the citizens and leaving the enemy untouched. The causes of some autoimmune diseases have been traced to environmental or genetic factors, even though some are said to be of unknown origin as well. So the third cause of abnormal high levels of FSH in younger women is psychological stress. So psychological stress, usually caused by persistent exposure to adverse life events, is known to negatively affect ovarian function. So there was a study that was carried out with about 43 women, and they tried to find out because these women had premature ovarian failure and they had FSH levels over 40, which was very abnormal for their age. And so they tried to find out what were the stressors or what happened in the lives of these women before this high FSH diagnosis. During the course of the interview, it was discovered that certain events occurred in their lives prior to this diagnosis, and these events are persistent exposure to workplace stress, persistent exposure to family-related adverse life events, and lastly, sleep problems and sleep disturbance. Stress can potentially cause temporary elevation in FSH levels. So to the part that I know you've been waiting for, how can you take care of high FSH levels? How can it be treated, especially if you are trying to conceive? First on the list to improve ovarian function and to lower your high FSH is to eat high quality food. What you eat greatly impacts your hormone levels. The food you eat are just doing two basic things in your body. They are either healing you or harming you. So make healthy choices. Go for high quality food. Avoid non-organic foods that contain endocrine disruptors like pesticides and herbicides, GMO foods, synthetic hormones. As much as you can, go for organic foods. Eat nutrient-dense foods, foods that are rich in minerals and vitamins that are necessary to support your hormone levels, and make sure you eat plenty of it. This is not the time to starve yourself. If you are trying to improve ovarian health, this is not the time to restrict calories. Eat plenty of nutrient-dense foods. Your body needs it. Go for healthy proteins and fats, lots of veggies, complex carbohydrates, lots of water. Stay hydrated. This is what your body needs. This is what your ovaries needs. A list of highly nutrient-dense fertility foods and recipes are all in my soon-to-be-released fertility boosting online course. So watch out for it. Be on the lookout. The course is coming. Okay, moving on. The next step is to lower your stress levels. Stress kills. Stress disturbs a lot in your system, especially as a woman. Lower your stress levels is non-negotiable if you are trying to conceive. Practice relaxation techniques such as deep breathing exercises, yoga, and mindfulness to cut down stress levels. You can also reduce your stress levels by exercising. When you exercise, certain chemicals are released called endorphins. These are natural stress relievers. So for a woman that is trying to bring down high FSH levels in order to conceive, please, nothing strenuous, just moderate exercise, walking for 30 to 45 minutes, maybe every day or on alternate days. Nothing strenuous, because if you do anything strenuous, it's going to be counterproductive at the end of the day. So avoid strenuous exercises. To further reduce your stress levels, you need to prioritize getting adequate sleep. Especially make sure that you are in bed before 11 p.m. This is very important because between 11 p.m. and 3 a.m., according to Chinese medicine, this is a period where a lot of rejuvenation, especially ovarian rejuvenation, occurs throughout the body. So a woman that is trying to conceive should not be awake by 3 a.m. If you need to be awake early, you can maybe shift it to around 4:30, 5 a.m., but not 3 a.m. because your body needs to be well rested for it to rejuvenate itself. So apart from eating high quality foods and lowering your stress levels, another tool that can be used to optimize and improve ovarian health and lower your high FSH is the use of certain professional grade nutritional supplements. These nutritional supplements contain essential vitamins and minerals that help with balancing hormones, improving energy production within the cell mitochondria. This is very essential for improving egg quality, arresting oxidative stress, and preventing DNA damage within the eggs. There are also certain traditional Chinese medicine herbs that are known to help improve ovarian function, but you need to be properly guided by an expert to make proper use of them. Fertility massages like the femoral massage can help improve blood flow to the ovaries and the uterus, and therefore increase your chances of conception. By increasing blood flow to your reproductive organs, you increase their function. Question of the day: what is your main takeaway from today's video? I would love to read your comments. All these strategies will help to lower your FSH and improve your egg quality for optimal fertility. Remember to click the like button and subscribe to this channel. Thank you for watching.